and welcome to the We Talk Health podcast, the official podcast of West Tennessee Healthcare. I'm your host, Kara Mobley, and on today's episode, we are talking about our mammography technology that is now available at our GYN Specialists clinic. Today, I have as my guests Dr. Frank Pierce and Amy White, nurse practitioner. Welcome to the show, guys.
Thank you so much.
Great
Thanks for having
here.
us.
Yeah, thank you.
Thanks so much for being here. So now I know we just got the 3D mammo at the GYN Specialist clinic about 3 weeks ago. So Amy, tell me a little bit about what that's been like. I know you've been on the show before, so.
Yeah, we're really excited to have a mammography machine in-house. It's so nice. Used to, we would have to, make our appointments and then schedule stuff at the imaging center or at outlying, hospitals, wherever the patients are from. But now we have the technology and the staff to make it happen on the same day patients come in for their annual exam. So we're really excited about that. It's a nice change. We've been waiting for a long time for that to happen. And so we're thankful and excited about having it in our building.
Right. Yes, this is a great update. So, Dr. Pierce, this is your first time on our show. Kind of give a little bit of information about yourself. How long have you worked here with GYN Specialists?
Great. I've been with GYN Specialists now just about 2 years. And previously I did OB and GYN, and then now have just focused just on the GYN only, and have really enjoyed that aspect.
Great. Now, have you and Amy worked together in the past?
We have.
For quite some time.
Yeah.
So I guess within the GYN Specialist, you guys got to have a lot of camaraderie going on.
Oh, we
within
do.
That department.
The four of us have been together for a long time, and so I think as far as our work family, it's a good environment. I'm speaking for all of us when I say this, but we're all happy to be there together, and I think that it makes going to work every day better. Honestly,
right?
Yeah, and so I think that's reflected in our patients too, because they know that we're all comfortable together. We know that they know that we've worked with the same staff for quite some time, and so this is just having mammography there is just an added benefit to an already good situation.
And I know, especially when you've got camaraderie between the care providers and with the staff as well. I mean, people can see that, especially like you've said that the people that work there have been there for a while.
Right.
I mean, that's not the thing people mostly think about when they think about going to the doctor. But I mean, having a positive environment is such a great, especially when you're going to the gynecologist. True. I mean, that's never the funnest part of someone's day.
True. We just strive to make it better than going to the dentist. But I think that too, speaking about the environment of our office, it is very aesthetically pleasing.
Right.
We've got some beautiful artwork in there. And I think, speaking from personal experience, having a mammogram is one of the most stressful days of my year. I hate it. It makes me a nervous wreck. But I think walking into our building and seeing smiling faces and seeing beautiful artwork on the wall, and it's nicely decorated, it's comfortable, it's private. So I think that as a woman, that's important. When you walk in and you feel like you're in a safe place,
right? And I'll mention up top here, and I'll also share this in the show notes, that the GYN Specialist Clinic is at 395 Hospital Boulevard in Jackson, which is right kind of behind the North Hospital there. So I know you mentioned there are 4 providers there, so it's Dr. Pierce, Amy White, Dr. Wilson, and
Dr. Jeff Ball.
Jeff Ball, that's right.
So there's a lot of experience. So
right.
I've been working with these providers for over 20 years. So there's just I think we do have a lot of experience.
Great, yes. And so in terms of having mammography on site, kind of tell me what the best benefit, what are the benefits of that in terms of, I'm making an appointment?
First of all, we encourage mammography just because breast cancer is the second leading cause of death for women in the United States. So it's such a critical component of well woman health care.
Right.
And so we do encourage that. Also, women live busy lives, and so it's sometimes hard to have an appointment for a visit and then set up another appointment for a mammogram. So to be able to do all that in just one visit, just to coordinate that care, I think is very significant.
Right, and I think in the past it would be you make your regular annual visit, then you have to schedule a second visit to have your mammography done, and usually it's 2 months out or so. So this is what's great about just being able to do it all in one appointment.
Sure. Yeah. And I think having it on site too, we've got a little flexibility in our schedule in that if a patient comes in and we recognize risk factors like a mother has breast cancer or a sister has breast cancer, and there's guidelines that we have to follow, and we can speak to that in a few minutes if you'd like. But I think just being able to walk them back there often, is so convenient, and it just takes the worry out, and it happens a little quicker.
Right. How quick is the turnaround on like receiving your results?
It's usually within 24 to 48 hours.
Yeah. So you're not, once you've had it done, you're also not just waiting around for weeks.
Correct.
Wondering, what the answers were.
Right. Yeah.
And we can talk about how this is part of the screening, which is where an imaging center would be where you would go more for diagnostic testing if something was found. So this is like the first line treatment.
This is a routine screening mammogram. And if something were to come back and you need additional imaging, then we would send you to the imaging center where they can do a diagnostic mammogram and or ultrasound if indicated. And those are recommendations made by the radiologist. Now, of course, if you come to us and you feel a lump or we feel a lump, we're going to skip the screening and go straight for a diagnostic. So that's not really what we're set up to do at our office. But the majority of women come in for routine screening, and that's who we're trying to capture.
Right. So we can talk about risk factors. Like, first of all, what age? Like, when would someone have to start thinking about when to go have a mammogram? In addition to
they used to talk about starting about age 35, having a baseline, but that's no longer in vogue. They really start talking about age 40. Almost all recommendations and societies recommend starting at age 40, either 1 to 2 years, and then age 50 every year up to about age 75 is kind of the current. We always talk about as far as a risk assessment, as far as is to look at that, and also just to talk about there are some side effects from mammograms. If you end up going through a breast biopsy, that can be stressful.
Yeah.
So you want to. That's one of the advantages of 3D is it decreases some of the chances for us to have some of those false positives.
Yeah, and also reducing the need for follow up.
Exactly.
As you had mentioned. Yeah. And now I see where we had talked about how it can also detect slightly more cancers. Talk to me a little bit about that.
Yeah, with the 3D, exactly, there is a little bit better detection as far as that, particularly with women with dense breasts. And that's a condition that's really inherited. There are a few modifications. A low-fat diet and exercise can slightly decrease dense breast, but 3D are much better at picking up breast cancers in women with dense breast.
Right. And would you know you had that? Like, would you have any symptoms of that? Or it would just be...
No, it's more of a radial, mammogramic finding.
And so, that would be what would catch that.
Yeah, exactly.
Okay, great. So so the quicker access, so that's always good. Now, when you talk about risk factors, like say I have a family history of breast cancer, would you need to go earlier than 40? Like how would you would talk to your provider, obviously, and kind of tell them.
There are a couple of tools that we can use as far as breast cancer risk assessment. Family history is one. There's a number, and the Gale model is one of the National Cancer Institute. We use that Gale model, or the Tyre-Cuzick is another model. So those kind of help us to look at women that may be at higher risk that you might want to modify that screening.
And I'll share our information on how to make an appointment if you want to make an appointment with GYN Specialists in the show notes of this podcast. But I also wanted to throw this to you guys too. As someone who sees patients, or if anyone listening to this podcast is wondering, or maybe has a family member who's a little bit hesitant or reluctant to go be seen, what would you say to someone if they're avoiding having a mammogram done, and it's something that maybe a family member, someone knows that maybe someone needs to be seen?
I think the most important thing is early detection is key. I mean, that is so important. I have so many friends and patients that have had breast cancer, and I mean, obviously, the earlier it's detected, the better outcome. And so that would be, as terrifying as it is, that's the bottom line is early detection. And our job is to look at, like Dr. Pierce was talking about, to look at family history and make a decision. Sometimes there's cases when you do need a mammogram earlier than 40.
Yeah.
And so I think we have to, that's something you talk to your provider about and see if you have family history. You know, there's all kinds of things we have to think about. When age of first child, did you breastfeed? You know,
all that.
Yeah. And who in the family had breast cancer? There's
which side,
primary versus secondary relatives, and and that's something that we sit down and talk about together. So.
Yeah.
I mean, one of the nice things about breast cancer is there's actually been some decrease in breast cancer deaths since the 1980s, and I think it's because there's been increased screening,
screenings,
and better treatment.
Right.
And so I think that combination, now that there's a lot more women living with that diagnosis, because of both of those,
living longer,
Yeah, and just kind of trying to reduce that fear of being seen. And again, like you said at the top, it's not a dark old building with it's a nice, friendly, bright environment. So you're not having to go somewhere that's like scary.
Right. And our mammography technician is amazing. Her name is Tina, and we're so thankful to have her. She's got a lot of years of experience. She worked in California, and then she's been at the imaging center here. So she's got a lot of years of experience. And she personally did my mammogram recently, and she did a great job. And I was very comfortable. And, you know, not that I wasn't at the imaging center, but it's to have something like that done. It is a nice facility, to have it done,
and all in one place. Like that's my thing. I like to just try to knock everything out in one visit.
Yeah, and I'll just echo what Amy said. Just Tina, I've had numerous patients come back and said, "Hey, that was a good experience,
right?
And not always a comfortable experience."
Yeah, and I assume in these past 3 weeks of it being at the GYN clinic that you guys have had several people coming in and out.
Oh yeah, we've been really busy with it, and you know, it won't always be that we can have an opening if somebody needs it right away. Then, but our goal is to eventually get those scheduled together. So we're trying really hard when people are coming in with their annual to try to schedule even a year out. And that's another nice thing about our clinic is we can schedule a year out. So
and just having it
together.
With it used to being just at the image, you know, having just that extra.
Yeah. And our receptionists are making the appointments.
Right.
And so when you call, you speak to someone in our office that has access to everybody's schedules. And so it just works. It just works. So.
Well, thank you guys so much for coming on and talking about this. And again, if anyone is wanting to make, or if this podcast reminded you that, I need to get my annual, the number for the GYN Specialist Clinic is 660-3344, and I'll also be sharing that in the show notes as well. Do you guys have any final thoughts for our listeners?
No, we just thank you for the opportunity just to let patients know that this is available. I think availability is probably the biggest key.
Yes, absolutely.
Thank you so much.
Thank you guys both for coming on.
All right.
Thank you for listening to We Talk Health. This podcast is not intended to replace any medical advice. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions or would like to request a topic, you can reach out to us at wetalkhealthpodcast@gmail.com.